Hello everybody, Dr. Caitlin here. We're going to go over some diaphragmatic breathing, just a fancy way of saying belly breathing. So when we come into this world as little babies, we actually naturally breathe through our belly, and sometimes it looks like the belly of a baby is kind of protruding, but that's just because they're breathing actually through their belly. And as we age, we start to do some chest breathing, and obviously when you're doing exercise, that's a little bit more chest breathing, but during everyday life, we should be doing more of the belly breathing. So I like to think of an analogy of like a pop can, and with no kinks in it, you can stand on a pop can and it's super strong, and that's kind of like what we're trying to do when we do some belly breathing. We're trying to build that 360 pressure to protect our spine from the inside. So we have a ton of muscles in the back protecting the spine from the outside, but we need something protecting it from the inside, and that can be a really strong core. And the basis of a really strong core is good belly breathing. So we're gonna go over a little bit of that today. So to start, we're gonna go on our back. And I'm gonna kind of pull down my shirt, or kind of make it tight so you can see. But basically, all we're trying to do is breathe through our belly. So I like to put one hand on my chest, one hand on my belly, and just try to allow my belly to rise. This is actually easier said than done. A lot of people, when they try to take a deep breath through their belly, their chest ends up rising too. So you really want to concentrate on trying to fill the air through the belly, really push the diaphragm down. So when you take a deep breath in, your lungs fill with air, obviously, and that pushes the diaphragm down. We want that 360 pressure throughout the belly. And I kind of like to say, you know, when you pretend you're pregnant, that's the kind of motion we're trying to do when we're trying to belly breathe. It is pretty uncomfortable, and if you haven't been doing it, it takes quite a bit to get used to, and you kind of have to consciously think about it. So belly breathing is not as easy as we make it out to be. And once you get that kind of down, there's quite a few progressions to this. I'm only going to go over one or two here. So when you're at home, you kind of want to get into the position of having your knees slightly pointed out, but your legs elevated. You can do it up on a couch, or if you do have a physio ball, those work really nicely. And then all I'm going to do is I'm going to take my fingertips and I'm going to push in where I want to cause pressure. So I have some kind of stimulus that I'm trying to push out against. And I kind of want to move it all different places. You might notice that one side fills up better than the other, and that's just something that we have to work on. We're always concentrating on trying to push out against those pressure points. The hardest part is getting that air way back here in the back, and that's probably what you guys are going to be working on the most, is trying to really do that 360 circumferential diaphragmatic breathing, trying to get that air around the whole belly. Thanks for watching.